shoulder tape. Again, thinking about your clinical reasoning and the particular patient that you might have with you, you need to potentially adapt it a little bit. So I use this particular taping for lots of overhead athletes. I think Gripit kinesiology tape is fabulous for lots of the patients I work with that are overhead athletes, that you need to maintain shoulder range but still give them some element of support so they can hopefully have less pain and keep playing. If I was to tape one of my overhead athletes with widget tape, they'd hate it. They'd just tear it off as soon as they left, because obviously they need that full range. So this is a really nice way of giving them support but still allowing them to have that mobility. So I can use this for post-op patients, for shoulder surgery, particularly subacromial bursitis patients, decompression patients, your rotator cuff pathologies, also for correcting scapular kinematics. So I'll show you the standard way, but you can add in little bits and pieces to change shoulder position as well. Now, you mentioned you have a bit of shoulder pain. Whereabouts is yours?
Sometimes, yeah.
More through the front.
Yeah.
Okay. So one of the things you could also do is actually do your humeral glide techniques as well. So tape from an anterior position, gliding the humerus and then coming down in through the back of the scapula, more as a support type taping. So using the stretch of the tape for support rather than for facilitating movement, I guess, in that point. Okay. So you'll need your 5 centimetre for this one, measuring from the base of the neck to the top third of the arm. And this is really similar to the technique that we do around the knee. You're wanting to make sure that you actually tape around the glenohumeral joint and up and around the AC joint. So you're really trying to assist with emplication of the humeral head into the glenoid. Okay? So same principles, you should be well and truly down pat with that now. Rounding our corners. Now, I place my first strip at the base roughly of the deltoid. If you've got good anchors on either side of a movable joint, you're less likely to have the tape come off. Okay, if you do anchors sort of up close, you're going to get more movement around those areas. So I try and have my anchors a bit further down, no stretch on those, the stretch around the joint, and then my anchor back up here as well. Now again, hair on the chest, if it's light hair, the tape will stick really nicely. If it's too dense, you might actually have to get the patient to shave that area. Okay, so we'll see how we go. So we'll peel back. Now you can pop this position, depending on their shoulder pathology and whether they're able to get into these movements, actually get them into a little bit of horizontal flexion. And thinking about where our glenohumeral joint is, we're going to go around the glenohumeral joint. So pop that area onto a little bit of stretch through the posterior cuff, and then letting them drop their arm back down to place that over the surface of their skin there. Okay, then we're going to do our second strip, again anchored the base of their deltoid. Now if they're able to, I pop them up into a little bit of external rotation. Okay, they might not be able to get all the way up here, and hopefully they probably aren't if they're coming with shoulder pain. But I'm going to go around the glenohumeral joint, and I only use my finger just like rigid tape to guide the direction so that we're not getting areas that are getting crinkles, and then you can drop that back down. Now this is a really important one, and I probably could even do more on this to make sure you've got your really good anchor point. So my anchor here is probably a good 5 centimetres over the top here. This one, because you're around a movable joint, you could actually even extend and start correcting shoulder blade position as well if you wanted to, or add additional strips to that too. Okay, so we'll add the decompression strip, which tends to work really nicely underneath the AC joint, lifting up into that tight position. Okay, so emplicating up that way. So again, you need to make sure you've got good anchor points. So a bit longer rather than shorter for these. That's it. Halving your tape and tearing the backing paper off. That's it. Peeling back your strips. And finding the base of your AC joint. compression, I've got my 80% there. I'm thinking about more from a pain point of view. And then my last strips, you're not going to be very impressed with me, are you?
Bum bag, bum bag.
Don't worry about this side.
Now, at the moment, I can see we're sitting a little bit anterior tilted, so I'm actually going to correct him to just apply the last part, so they're actually correcting while we're taping as well. Okay. So, if I take away my hands there, and you've just relaxed into your shoulder tape, just show us what your shoulder range is like. So we can still get overhead. Oh, we've peeled back a little bit there. So I've done that probably a little bit too tight if we're going up into that position and it's rolling back. So we can either loosen it off. I'll probably redo that strip and just do it a little bit less. I did 80% there, but I'll probably back that off to 60. So you need to test before you send your patient out as well. So I might actually just redo that one just so you can see that. I'm sorry. You want to do it? It's a bit mean, isn't it?
Do the other.
Do you want me to do the other one for you?
No.
That can be the grand finale of the day.
Okay, what I will do for this one, because we're correcting that position a little bit, can you see that we're wanting to come through there? I'm actually just going to correct your posture a little bit. Okay. That's it. Okay, so I've done a little bit less stretch through there now. Just see if that makes a difference to your shoulder range.
And that's easier.
A little bit easier.
Mm.
Does it feel different to what I did before?
Yeah. It's more facilitating the movement, I think.
Yeah. So I've started to correct his posture there, but it depends what you're trying to achieve. So I've clinically changed that a bit, and also because he wasn't particularly sore. Okay. So that will be a good one for you to practice. If someone's got shoulder pain or pathologies, it might be worth having a chat with them about what you're trying to achieve, and you can pull and I'll come around. We can actually work on some different shoulder positions as well. Okay. But that's a really nice one to use for your patients, especially in the clinic.